Working with limited resources, healthcare providers today are challenged to meet ever-increasing demands. In order to meet this challenge, your organization needs to be as efficient as possible. This starts with giving your most important resource, your people, smart, time-saving tools that allow them to spend more time doing what they do best, providing high-quality care. That's where Microsoft Office 2010 comes in. It's not intended to replace your EMR or hospital information system. Rather, it bridges the gap between these and your other core systems to play a vital role in helping all your staff connect with information, people, and processes when, where, and how needed. The capabilities of Office 2010 can turn data into insights that help physicians, administrative staff, and other health workers make more informed decisions. In an effort to improve quality, a director reporting to the COO is preparing a dashboard showing performance against a variety of metrics, including financial management, patient satisfaction, and things like bed availability. With Excel 2010, it's easy to get insights from information and present those insights in a visually compelling way. First, Anna can use conditional formatting, introduced in Excel 2007, to make more sense out of this table of data. To help with trend analysis, where traditional line charts can fail, she can use the new Spark lines, which enable her to visualize each item by creating a mini chart in a cell. She can add high points, low points, different styling, and even use fill down to visualize all of these rows of data. With Power Pivot and Slicers in Excel, she can very quickly add filters that let her work more easily with complex pivot tables. Notice how she can easily slice this data about employee absence to uncover insights. And she gets the same speed and performance even if working with millions of rows of data. In this case, she can see that in March and April, a few departments had a much higher number of sick days than other departments. This might help to improve work conditions to increase the efficiency of those departments. Notice that as the slicers change the pivot table data, not only does the chart change, but the column-type spark lines change as well. Now that she is finished, she can use the backstage to finalize the report and save it to SharePoint. In SharePoint, her team members can collaborate on this document using check-in, check-out, version control, and workflows, and they can even work on the spreadsheet right in the browser. And as you can see, with SharePoint managing the document, more than one person can be working on this spreadsheet at the same time. Meanwhile, the service line manager for oncology needs to put together a presentation that shares insights and recommendations with his colleagues. He adds some of the research in the spreadsheet to a slide. And he's ready to show the deck to his team. Instead of setting up a full web conference using complex audio and desktop sharing, he can use the PowerPoint broadcast capability for just-in-time show and tell. All he does is click Broadcast Slideshow, choose his SharePoint server or the Windows Live service, click Broadcast, and email the link to his team. Now everyone can follow along in their browser, whether it's Internet Explorer, Firefox, or even a mobile browser on a phone. To make it easier for you to visualize the experience, we'll just use Windows Snap to show PowerPoint and a browser side by side. As you can see, when Dr. Ken advances his slide to the left here, the browser at the right keeps up, so everyone is on the same page. These are a few examples of how Office 2010 helps you get insights from information, brings your ideas to life, and have the best user experience across the PC, the browser, and the phone. Office 2010 helps enable care team collaboration for greater employee satisfaction and improved patient outcomes. For example, instead of using email, phone, or even paper stickies as the primary collaboration tool, Now, multiple people can work on the same document, such as a discharge summary, at the same time in many Office 2010 applications, with the document owner retaining full control over which parts can be edited by whom. Here, you can see a nurse is working on compiling a discharge summary. She needs to get input from the lead physician on recommended ongoing therapy and check the details with him before the document is sent off. Thanks to co-authoring in Word 2010, Nurse Karen can work on her sections, and each department can work on its relevant section. Each author can also see where the others are in the document and even interact with them through integrated presence. When everyone is done with their work, there's no need to spend any time or risk errors in combining multiple documents. The nurse can see the changes that others have made, highlighted in green, and she can review and finalize the document with the easy-to-use formatting options that only Microsoft Word 2010 provides. Now the patient team has a complete report to follow up on recommended treatments and medications. Another capability that enables people to work better together is a great search experience that surfaces the most relevant content and context at the right time. Nurse Karen wants to do some research on how to create the best discharge summary. With fast search, she gets great results, from people that have skills in this area, to sites, to documents. With these dynamic refiners on the left, she can really drill down to just the content that seems right, and she can even preview this content right in the browser. Office 2010 enables your staff to connect with information, people, and processes everywhere interaction with patient information occurs and care is delivered. You have seen some of the web applications. Let's look at offline access to information. Dr. Molly Clark consulted on the case that Nurse Karen just worked on, so she also needs to provide input on the treatment plan, but she is heading out to a conference. With SharePoint Workspace, she can take all her SharePoint content with her and work at her convenience. All the documents and lists, and even workflow tasks, such as this one reminding her she needs to work on the Ann Weiler discharge summary, travel with her. The next time she connects, SharePoint Workspace will intelligently sync her work back to SharePoint. She could also use a mobile phone with Office Mobile to work with this content. SharePoint Workspace Mobile connects her to all of that same content, and she can open and edit documents right from her phone, so the patient's care won't have to wait for her to get back to the office. Office 2010 provides a consistent experience regardless of how you connect, whether it be a PC, a browser, or a phone, and whether you're in the office, out of town and disconnected, or in a cab on your phone. Office 2010 gives staff the ability to complete patient and administrative processes from within Office and gives IT and the board the peace of mind that sensitive organizational and patient information is secure and protected. For example, while Nurse Karen and others were working on their discharge summary, they were focused on their patient, not on configuring security for the document. But notice that the document is protected. Nurse Karen can only work in her sections, and if she tries to edit the treatment plan, she can't. Another example of the practical productivity platform is the web applications themselves. Notice how the discharge summary looks great in the browser. IT can rest assured the documents won't lose formatting or data, even when they are round-tripped between the browser, desktop applications, and the phone. By providing capabilities to use Office 2010 anywhere, bring ideas to life, work better together, and provide security and manageability through a practical productivity platform, Office 2010 offers a world of advancements that can help your entire staff work more efficiently and effectively, in more ways and from more places.